Effective antiviral therapies that reduce the risk of COVID-19 progression are needed. A new study examines the safety and efficacy of Molnupiravir, an oral small-molecule antiviral prodrug that can inhibit replication of SARS-CoV-2 and render it non-infectious. In this international Phase 3 double-blind placebo-controlled trial, 1,433 outpatients with mild or moderate COVID-19 who'd had symptoms for 5 days or less, had at least one risk factor for severe illness, and were unvaccinated, were randomized to receive either 4 200 mg capsules of Molnupiravir or placebo twice daily for 5 days. In a planned interim analysis performed when 50% of the trial's participants had been followed through day 29, Molnupiravir was superior to placebo in reducing all-cause hospitalization or death, with 7.3% of the treatment group meeting this primary endpoint versus 14.1% of the placebo group. When all randomized patients were included, the difference between groups was smaller, but still statistically significant. Some subgroups, including those with previous SARS-CoV-2 infection, low baseline viral load, and diabetes, did not see a benefit with the antiviral. When assessed as an individual outcome, the incidence of death was lower with the antiviral. The rate of adverse events, the primary safety endpoint, was similar between the treatment groups, 30.4% with Molnupiravir and 33.0% with placebo. The authors conclude that early treatment with oral Molnupiravir reduces the risk of hospitalization or death in unvaccinated at-risk patients with COVID-19, with no apparent safety concerns. Full trial results are available at NEJM.org.